Do you remember a time when a child in school suddenly had a mild rash and felt a bit off? Rubella, also known as German measles, may be to blame. It's not usually serious for most people, but it can cause big problems if a pregnant woman catches it. Imagine your body being invaded by a tiny, invisible germ that spreads when someone sneezes or coughs near you. That's rubella for you, silent, sneaky, and sometimes dangerous. Have you ever been around someone with a light pink rash who said they just had a cold? It might have been more than that. So what actually causes rubella? It's caused by a virus, specifically the rubella virus. Think of it like a tiny, unwanted guest that enters your body through the air, like when someone with rubella coughs near you. Once it gets in, it starts multiplying and moving through your bloodstream. It's not bacteria, so antibiotics won't help. This virus only affects humans, so it spreads from person to person. Ever shared a classroom, office, or bus with someone who was sick and later you felt unwell? That close contact is often how the virus passes around. Now, how do you know if someone has rubella? The symptoms are often so mild that people might not even know they're sick. But common signs include a pink rash that starts on the face and spreads down the body, kind of like how paint spreads on paper. The person may also have a low fever, runny nose, red eyes, and tender lymph nodes behind the ears or on the neck. Try gently feeling behind your own ears right now. Notice any lumps. Swollen glands can be a clue. Some adults, especially women, may also have sore joints. But here's the tricky part. Up to half of people with rubella don't show any rash at all. That's why it spreads so quietly. How do doctors find out if it's rubella? They can't just guess from the rash, because it looks like many other illnesses. So a blood test is needed to check for rubella antibodies. Think of antibodies like your body's wanted posters. For the virus they show, the immune system has seen it before. If the test shows certain antibodies like IgM, it means the person is currently infected. There's no specific medicine to kill the rubella virus. So treatment is about comfort rest, drink water and medicine, like acetaminophen for fever or pain. But remember, never give aspirin to children. The body fights the virus on its own like a hero, cleaning up a mess. Can we stop rubella before it starts? Yes, and the best way is vaccination. The MMR vaccine, measles, mumps, rubella, is like a training drill for your immune system. It shows your body what the virus looks like without making you sick. Most kids get 2 doses, one at 12 to 15 months and another at 4 to 6 years. Have you checked your own vaccination record lately? If you're planning pregnancy or work with kids, being protected matters even more. Vaccination not only keeps you safe, it protects others, especially pregnant women and newborns. It's like wearing a mask to protect others, but this one lasts for years. While rubella is nearly wiped out in many countries thanks to vaccines, it still exists in some areas. Recent efforts focus on global elimination, like chasing the last hiding spots of the virus. Scientists are also working on better tests that can detect rubella faster, even in remote areas. Some studies are looking at new vaccine delivery methods, like skin patches instead of shots. Imagine getting protected without a needle. Also, researchers keep studying how viruses like rubella change over time, so vaccines can stay effective. The dream, a world where no baby is born with serious problems from rubella, just like how smallpox was beaten.